We've been networking our little socks off with some really wonderful international nurses, and it's been, just like everybody says at conferences, that's gold.
Talking about the biopsychosocial kind of care of people with MS, and DMTs only go so far. And so it's all the other things that people can do to take control of the disease a little bit themselves, and the role that the MS nurse has in that, in educating patients around that and supporting them in making those healthy changes that really have a large impact.
We're very lucky in our role, actually. I feel like that's why maybe MS nurses stay in post for so long, because it feels like a real privilege, doesn't it?
It is, because you get invited into their world and it becomes quite intimate.
Hi, I'm Fiona de Young. I'm a clinical nurse specialist in multiple sclerosis based at Auckland Hospital in New Zealand.
Hi, I'm KJ Lazarus, and I'm an MS nurse from the Auckland Hospital in Melbourne at the NCRES unit.
And I'm Brett Drummond. You're listening to the ECTRIMS podcast, the official podcast from the European Committee for Treatment and Research in Multiple Sclerosis. MS nurses play a highly specialised and unique role in the journey of people living with MS. Their interactions require them to be able to communicate effectively about a vast array of topics, ranging from personal issues that patients only feel comfortable disclosing to their MS nurse, potential lifestyle modifications that may improve brain health, family planning decisions, and ensuring understanding of treatment schedules and side effects. As this already complex role continues to evolve, it is critical that MS nurses are able to connect and share. My guests in today's episode, Fiona and KJ, are both experienced MS nurses from around the world. KJ, thanks for joining me.
Thanks for having me.
I'm very excited to be here.
So I think as a starting point for the conversation, what would be really helpful for our audience, especially considering it's a continually evolving discipline, is just a quick discussion around, in 2024, what is the role of an MS nurse in your eyes?
I think the role of the MS nurse, it's evolving every year with every new treatment, with every new interaction we have with our patients. That's what makes MS nursing exciting, don't you think?
It is. I think we have both been MS nurses for quite some time, and it's been exciting to be part of an evolutionary area of healthcare, and things have changed a lot in the time, and it's great to see how patients now can live quite well with MS, and think that still comes with a lot of support where possible, and we're available to people with MS nurses. And I think that came into the conversation today. We heard about in ECTRIMS about the MS nurse role.
For sure. Yeah, it was exciting, wasn't it?
It was exciting.
This is my first ECTRIMS, and it's great. There's a nursing session, a whole day of it.
I think it's great. It'd be nice for some of the doctors to come and hear some of the nursing sessions. It would be good maybe in the future to be have that crossed over a little bit.
Yeah, it was lovely, that poignant introduction about June Halper this morning, wasn't it?
It was.
I think when you lose a giant from an industry like that who's influenced MS nurses across the world, it was lovely that the American nurses were able to intro that this morning.
Absolutely. She's the original MS nurse, and really did shape what the MS nurse is today. And thanks to her and her drive and vision, MS nurses are what they are today because of her and the things that she's put in place.
I think the fact that we have now 2 sessions at ECTRIMS, and this has grown over recent years, we're seeing more of a focus on it. I think really recognising the important role that MS nurses play in the lives of people living with MS. We hear a lot from people living with MS that the connection with their MS nurse is really important. And I think that's reflected. So going through the sessions that happened at ECTRIMS 2024, what were some of the highlights for you in terms of some of the things that were discussed in those?
Such a big focus on brain health, I think, for all of ECTRIMS actually this year. And that was shining through in the nursing presentations, wasn't it? And I felt like that was a great way to start the day.
Absolutely.
Erin from America set us up really nicely with the background of brain health.
Absolutely. It really has been something that's been discussed in almost every lecture that I've been to so far at ECTRIMS in regards to brain health. It may not have been called specifically brain health, but talking about the biopsychosocial kind of care of people with MS, and DMTs only go so far. And so it's all the other things that people can do to take control of the disease a little bit themselves, and the role that the MS nurse has in that, in educating patients around that and supporting them in making those healthy changes that really have a large impact. It's sort of part of good MS care is actually brain health.
And we talked a lot about empowering our patients, but it was quite an empowering session for MS nurses.
I was actually about to say it was fantastic to see the representation of the MS nurses across the two sessions, in actual fact, that globally they were well presented from different areas, and we were very lucky also to have one nurse presenting today who's actually not an MS nurse but a specialist nurse in her own field, but lives with a diagnosis of MS, and the crossover and how she has taken some of the information that she has from her cardiovascular expertise and living well and you know, in that space, and has taken that on board with her own brain health and the choices that she's made to do that part of her healthcare and take care of her mental health and her physical health and those other aspects that are covered in brain health.
Catalina, yes, she was a unicorn, wasn't she?
She was
wonderful, and she was just so she was full of joy, actually. That was one of my favourite parts of the day.
She was just so grateful, and she was able to say, even though she herself is a nurse, how important that nurse was and has been and continues to be in her journey. And I had the good fortune to have a quick chat to her outside the session, and how pivotal that person has been to her, and she is, you know, helped shape everything that, you know, the choices that she makes, and having that cheerleader on her side has really been helpful in her own personal journey. But it's also really exciting to see what MS nurses are achieving in different parts of the world, with Elizabeth with her doing her PhD in Belgium and taking that Brain Health Time Matters document and actually looking at the breakdown of the things that are covered in brain health around exercise and weight and BMI and diet and control of the comorbidities, and the impact that can have and the better outcomes. Smoking obviously is another one, and how they're looking at the data. And I thought that some of the data in that was quite surprising in one way, but I guess the amount of people who are not yet doing healthy diet and things like that was probably lower than what I would have anticipated necessarily. But I think I base that on what we talk about in our clinic.
Yeah, I thought that was really insightful. I'm really looking forward to reading more of her work, actually. But it was just such an encapsulation of everything you think about for brain health. That study was, and you could tell the audience really had lots of interest in her presentation.
Yeah, I think a lot of people were really interested to know what was going to come out of her PhD and how that information was going to be usable and adaptable into, you know, strategies or protocols or, you know, processes that could be used in other spaces.
So just following on from something that you said there, KJ, around some of the data being surprisingly low in terms of some of the uptake and some of these brain health activities that people can be taking. And you both mentioned that part of the session today was not just about how you go about empowering people living with MS and the patients, but also empowering the nurses to have these conversations. Was there any sense as to why these numbers might be low? Is it that the patients are making the decisions around it, or there's still a lack of awareness or understanding? Do we need to get better at communicating these messages through? What do you think, if it wasn't discussed, do you have any insights from your own personal roles around, you know, where some of those barriers might be?
I think that's a very interesting question, and I think it's multifaceted. I don't think there's a simple answer for that, and especially in this space here at ECTRIMS. This is a global event, and so as was discussed in the second session around self-advocacy and self-management, you know, there are different pieces at play around policy and a whole lot of other things and resources. And whilst I had a few questions in my own mind with that first session in relation to, there were a lot of nurses in the room, and Erin from America was talking about her experience as a nurse practitioner, which was fantastic. But it made me wonder about the patients that don't have access to MS nurses and don't have access necessarily to that sort of supportive education that is pivotal in self-advocacy, because you need to understand what's going on and know what your choices are and know the why and the how. And there was a little bit of a reflection in the second session about, for example, the quit smoking campaigns that most countries will have in general sense. But patients have heard that a million times, but they continue to smoke. But when they have a discussion, for example, an MS nurse, and explains the why that smoking isn't great and the research that's come out of that, looking at worsening disability and increased relapse rates if you are a smoker, that changes their education and their understanding, and so they're more likely to make that change for themselves in quitting smoking, as an example. And so I think, in answer to that question, I think it's really tricky because I think some centres are well set up to be able to educate and provide patients with that information. But if there are others that maybe don't, MS nurses aren't everywhere. Quite frankly, probably I think it's fair to say there aren't enough of us. And then some countries don't have them at all because of resources. And so therefore, it's a little bit of mix of lots of things. Patients not wanting to make the change, or maybe not understanding the change, or not having the capacity, either due to finances or resources, or even
barriers.
Or there was a discussion around barriers and mental health and cognition, and everyone needs to prioritise what is important to them individually. And I think that is another role of the MS nurse, to help the patients find out what those priorities are and help them work through those. And people find support in different places for different reasons.
There was a slide that talked about everyone being unique and how that sort of tailored care was so important, wasn't it? What works for one person isn't going to work for another.
No, and I think in our own practices, I think you and I are fortunate in Australia and New Zealand that, we do a little bit of, we model and make bespoke care for our individual patients by getting to know them and building those trustful relationships with them, and trying to hold their hand in the way that they need us to hold their hand. And sometimes that's in the physical sense of actually physically holding them a hand and passing them a tissue. And sometimes it's just sitting back and letting them share what they need to share, and us helping to guide them through, those pathways for, we're getting into the second session now, but about self-management and self-advocacy, so they can attain those brain health goals, and helping them set those goals with the education and the understanding.
But that's one of the beauties of our roles, isn't it? We know our patients for a really long time, and it's like an exchange of, if you both respect each other and you're working as a team in a partnership, it's an easier discussion to have about changing lifestyle aspects.
Absolutely. It's a gift, I think,
So lucky.
Yeah, and we were talking also about, celebrating the small wins. I give a lot of high fives. A lot of patients think that's cringy, as my children would say. But I think, those small wins are really important. And I think if it's a step forward, even if it's a tiny step, it's still a step forward. And I think all of those things should be celebrated, and having an understanding of the disease process, and maybe understanding the patient and their circumstances, whatever they may be, and being able to celebrate with them is a joy for me. It's something that I get really much a reward from as an MS nurse.
It's exciting, isn't it?
It is.
To be there for the really good things as well as like some of the traumatic, post-relapse recovery, things that are really hard going, Then you get the fun of someone's new puppy, or a new child, or that sort of. We're very lucky in our role, actually. I feel like that's why maybe MS nurses stay in post for so long, because it feels like a real privilege, doesn't it?
It is, because you get invited into their world, and it becomes quite intimate in a way.
Yeah.
And when you build these strong relationships that are pivotal in these things, in helping them in their journey with MS, it really does.
I mean, where else can you manage to suggest to someone to stop smoking, drink less, stop drinking, do more exercise, and to be able to frame that up in brain health, and be able to sort of work with someone to sort of actualise that. Yeah, that's exciting.
And see the outcomes of it, which is also something that's very specific to, nurses that work in chronic healthcare. We have these relationships with patients that are very long-lasting. It's not a sort of nursing role where they come and go.
So one of the things I think that came up in some of the answers there is talking about different access to MS nurses around the world. Obviously, this is an occasion where we're getting people coming from lots of different locations to talk about this. Obviously, everyone in this room is sort of coming from a very similar geographical region, and we talked on the Nurses podcast ECTRIMS 2023 in Milan around some of the stuff around the MS Nurses Care Report that came out of Australia. In some ways, I think Australia is fortunate in some of the MS nursing spaces. But did you get a sense today around, what is the state of MS nursing around the globe? Are there huge differences that are existing in different areas in terms of access to this, in terms of, what's going on? Was any of that discussed today?
I think there's more things in common than massive disparity. Mm-hmm. I think it was really useful when Mavis shared the UK competency framework they've been working on. There's a feeling like each region or each country needs to start from scratch and make guidelines for how we practice, but it's a shame to reinvent the wheel. So it was helpful to have that discussion. Everyone's been a novice when they start in practice and moving through to sort of being more expert in their practice. I felt like that was quite a uniting aspect of this afternoon.
I think it was. I think also it was interesting because Joelle from the UAE, and she was talking about that she feels that her MS nursing, or the MS nurse role, I should say, in the UAE is still sort of in its infancy. It's only been around 10 years. And again, she paid homage to June Helper for the support and the backing of that and developing that role in that space. So I think it is an ever-changing thing we were sort of speaking about before with evolution, and whilst I think a lot of us are very keen to work together so that there is a lot of more consistency, we all have the same intent, that is for sure. We all have the same intent that the patient is front and centre and the purpose of everything that we do. And living well is something that not just with more efficacious MS therapies, and there's different access. I mean, even just between Fiona and I in New Zealand and Australia,
it's quite wide, isn't it?
It's quite wide, and the drugs that are available in just Australia and New Zealand alone. And we know that that's the case in many places around the globe, and Joelle also made mention of that. And so some of those sort of things shape the differences, but I think ultimately everyone has the same intent: to take care of the patient, allow them to live well with MS, enable them in a way that is, bespoke to the patient, to the individual, get to know them, listen to them, help them resource what they need for brain health, self-advocacy,
and as a takeaway from the day, you didn't need to have massive expertise in a particular treatment, because everything that was discussed actually was really nursing-based and helpful, no matter what your sort of country's financial access to certain treatments were, which is amazing because you want to be able to be inclusive with your audience. Don't you?
And there was absolutely consideration around cultural change and local area specifics around, what is appropriate or acceptable, and stigmas in different countries. And I think some of them are very similar and some may be a little bit different.
So I guess there was a lot of information covered across the two sessions. When you go back home and communicate the key takeaway messages to people who weren't able to attend, if you could only tell them one thing, what would be your one message that you would like to take back?
Oh, there's never one, Brett. Let's be honest. I'm not good at saying one thing. I think, the importance of the nurse role in brain health and framing it. I think traditionally I have framed that conversation a little bit around disease-modifying behaviours, but that's just something because that's what before we had brain health, that's the way I framed it. But I think it's really important, and that the importance of the role of the nurse in that with the brain health, and that does tie into sort of self-advocacy and management as well. But I think, like Fiona, in your presentation, which was fantastic again today, you had a great slide that showed a lot of resources and things that are digitally available to people no matter where you are, so long as, obviously, and so long as you have digital access. But there are different things happening, and you use some examples of Australian opportunities with MSTranslate and get your head around it, as well as in Canada and the UK, and all these other opportunities for either nurses to further their education and knowledge. MS Pro was another one that you were sort of mentioned, and MS Selfie, and also other things that, like MS Selfie, that could be used for patients to help their understanding and their education. And so there was a lot of opportunities there and resources that are available, and it would be great to have those resources available to all of us, so we're not reinventing the wheel, and it gives a bit more consistency to what is shared globally even.
There's a lot out there actually, isn't there? It's overwhelming. And I think I said in the talk, I think we owe a lot to people who are passionate out there in the world with MS who are driving forward that sort of content that's available online. But remember, I kept going on about barriers to people being able to self-advocate and self-manage, and I think it's great to have lots of online content, but only good if you've got enough money to top up your phone.
Correct.
Or, great to have MS nurses, but only good if you've got enough money to put petrol in your car to go and see them. Yeah. But I'm pleased you enjoyed it.
Yeah.
What about for you, Fiona? What was your one message that you'll be taking back?
Well, we've been looking a lot as a group in New Zealand about making national frameworks and standards, and we work a lot with MSNA and our Australian colleagues about framing up competencies, I suppose. So it's really helpful to be able to have the UK MSNA's plans on how they're helping MS nurses, progress through their level of education. So I'll be definitely sharing that with my colleagues and the rest of the nurses in our country. I think sometimes we're so busy with such big caseloads and, doing the work we love in clinic that actually having time to do that externally and pushing that forward take quite a lot of energy. So we've been lucky, I think, KJ. We've been networking our little socks off with some really wonderful international nurses, and it's been just like everybody says at conferences, that's gold, and actually taking home some of contact details of other people is almost almost bigger than some of the things you hear.
Absolutely.
That ability to kind of link in globally. The world feels quite small right now here in Copenhagen, and I love it.
Yeah. I think that networking is so invaluable.
And we're good at it. We like a good chat,
yeah,
don't we?
Well, clearly
Solid.
we like a bit of a chat.
Yeah.
But, I think that is so important moving forward and to build those relationships and hopefully work together and do things that are not so much in isolation. And
it's good to have that on the first day because we're going to bump into these people for the next couple of days. But I do wish that we could potentially have had more of our medical colleagues involved in that conversation today, because MS nurses, this is our bread and butter really, isn't it?
Yeah.
Talking about this content that we were talking about today.
Yeah.
I think some of our neurologist colleagues would have really benefited from listening to some of those presentations as well.
Yeah, I agree. And again, not all of the neurologists that are here today have access to MS nurses and things. And so it would be good to be able to share that information a little bit wider than speaking to the converted in a context. Sort of, there were a lot of people in that room that were already on board with some of the things that we were saying and experiencing in their own practice. Yeah. And so if we're wanting to put the MS nurse forward a little bit, I think we need not just MS nurses to back us and to push us forward and reflect the importance of the role of the MS nurse.
So in 12 months' time, when we meet again in Barcelona 2020 for ECTRIMS 2025, would you say that's top of the wish list in terms of what you're hoping to see as we continue to see a greater focus placed on MS nursing? Is it more interactive sessions, sort of combining MS nurses with neurologists and other healthcare professionals so that these conversations are happening with a broader group of people who can benefit from them?
Yep, absolutely. You could have some great panel discussions actually that had a mix of allied health neurologists and MS nurses, and that I think would work really well.
Yeah, I think panel discussions, not just nurses, but like you said so beautifully, is the allied health that we also tap into, again, reflecting on brain health, that it covers a lot of things that we do utilise a lot of allied health for around psychology or physios, OTs, continence. There's a lot of sort of specialty areas within it being such a complex. So we don't want to make it bigger than being her, but it would be good to be able to have some more shared conversations as opposed to side conversations.
Yeah, and this sort of scientific role part of ECTRIMS, that I think that would fit really well. It doesn't need to be specifically nursing at all. So that would definitely be in my wish list for Barcelona.
Well, we started the day looking back on the previous 40 years of ECTRIMS, celebrating our 40th anniversary. We look forward to what we've got coming next, and I think with the discussions that we've had today, with you sharing your insights on these and thinking about where we can take MS nursing forward. I'm really hopeful that we'll see some of these changes happen. Thank you both for sharing your time, your expertise and your insights with us today on this podcast. It's been fantastic.
Thank you for the opportunity.
Oh, our pleasure. Thank you so much.
Thanks everyone for listening. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MSTranslate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MSTranslate and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2024-25 ECTRIMS podcast series is supported by educational grants from Alexion and AstraZeneca Rare Disease and Novartis. Educational grant providers have no input in the podcast content. You can read more about the topic of this latest podcast episode and more on the ECTRIMS website, ectrims.eu. Do subscribe to the ECTRIMS podcast on your favourite podcast channels and follow ECTRIMS on X, formerly Twitter, LinkedIn, Facebook and YouTube.